Happy Sabbath and welcome to the Hayden Lake Health Bite. Keep thy heart with all diligence, for out of it are the issues of life. Proverbs 4:23. One person dies every 33 seconds in the United States from cardiovascular disease. About 695,000 people die from heart disease every year. That's 1 in every 5 deaths. The women's death rate from heart disease is 8 times higher than their death rate from breast cancer. Heart disease kills more women than any other disease. Autopsies performed on 20-year-old American GIs during the Korean and Vietnam Wars and on accident victims aged 18 to 35 have consistently shown over 80% of them already had plaque in their coronary arteries. Does genetics make us more susceptible to heart disease? According to the China study conducted in the 1980s, within ethnic groups, a similar relationship between diet and disease is seen. For example, Japanese men living in Hawaii or California have a much higher instance of coronary heart disease than those men living in Japan. The cause is clearly environmental. Americans subsist mostly on animal foods and processed foods. The cultures that have the lowest heart disease rates eat less processed foods, saturated fat and animal protein, and more whole grains, fruits, and vegetables. They subsist mostly on whole plant foods. The more saturated fat and processed foods people eat, the higher their risk of getting heart disease. But as other cultures come to eat more like us, they also have seen their rates of heart disease skyrocket. Remember, it's called fast food because it speeds you up to the grave. Within 1 hour of eating at McDonald's, for example, triglycerides shoot up, the arteries stiffen, raising blood pressure, and it takes several hours to recover. And this is amazing. Slow plaque buildup occurs over a long period of time, but the blood can find another route around the blockage, and this is called collaterals. They are created and they bypass the blockage. But if there's a partial blockage with no collaterals and the plaque ruptures, a blood clot forms and a rapid total blockage causes a heart attack. The blood flow to the muscle is cut off and the muscle begins to die. 1 out of every 3 people who suffer their first heart attack will die from it. According to Uchee Pine's Lifestyle Center, several other things increase one's risk of having a heart attack, such as being overweight, having poor posture, especially stooping, having low lung capacity, reduced exercise, increased intake of sugar and alcohol, a pulse over 80, emotional stress, and coffee. A sugar-laden diet is linked to heart disease, according to the American Medical Association. A sugar-laden diet may raise your risk of dying of heart disease even if you are not overweight. The study showed that the odds of dying from heart disease rose in tandem with the percentage of sugar in the diet, and that was true regardless of a person's age, physical activity level, and body mass index. If most Americans already have early to advanced stages of heart disease, how do we stop the progress and reverse it? We go to the Bible. Then God said, I give you every seed-bearing plant on the face of the whole earth, and every tree that has fruit with seed in it, they will be yours for food. That's Genesis 1:29. So according to the Bible, what is the best food for us? Plant foods. And according to the National Library of Medicine, they also confirm a plant-based diet is increasingly recognized as a healthier alternative to a diet laden with meat. Atherosclerosis associated with high dietary intake of meat, fat, and refined carbohydrates remains the leading cause of mortality in the U.S. Dr. Esselstyn studied the effects of a whole food plant-based diet on people with coronary heart disease, and he's had the most spectacular results ever recorded. He studied a group of 24 patients with severe heart disease, 5 of whom were told they had less than a year to live. They were put on a plant-based diet. 6 dropped out. 2 of that group died. The other 4 all had bypass surgery. Of the remaining group who continued on the diet, all stopped or reversed their heart disease. All have had active, full lives for 20 years after the conclusion of this study. This is a photo of one of Dr. Esselstyn's patients. This is a coronary angiogram of the distal left anterior descending artery before and after 32 months of a plant-based diet without cholesterol-lowering medication, showing profound improvement. Dr. Dean Ornish selected 48 patients who had documented heart disease severe enough to warrant surgery, but 28 of them opted to enroll in a 1-year lifestyle program. They could eat as much food as they wanted of fruits, vegetables, and whole grains. They exercised 3 hours a week. Their cholesterol dropped from an average of 224 down to 172. Chest pain relieved, blockages diminished. 82% had regression of their heart disease. 65% of the patients had eliminated their chest pain over the course of 1 year. The other 20 of the 48 chose a conventional drug protocol. On average, these patients saw a 165% increase in their chest pain. Cholesterol levels were significantly worse, and blockages in the arteries worsened. Dr. Ornish states, "We do not need to crack open our breastplates to reroute our arteries. We do not need a lifetime of powerful drugs in our blood. By eating the right food, we can keep our hearts healthy." Uchee Pines Institute also says, "We find that a total vegetarian, low-fat diet will invariably lower the blood cholesterol by up to 200 points within a month's time. Drug companies are overjoyed if their cholesterol-lowering products achieve a 10 to 15-point decrease in 6 months." The healthcare establishment is structured to profit from chemical and surgical intervention. Diet takes a back seat to drugs. According to Harvard Health, people who took any kind of cholesterol drug, a statin or some other type, were nearly 4 times more likely to report memory loss right after starting on the drug compared with people who didn't take any kind of cholesterol drug. And the FDA also warns that some people have developed memory loss or confusion while taking statins. But good news, by God's design, the human body has the ability to heal itself, given the right conditions. Along with a plant-based diet, polyphenol-rich berries are one of the top dietary recommendations for heart health. And walnuts have a more favorable ratio of fatty acids than any other food. A couple of tablespoons of walnuts taken daily can be an important factor in controlling cholesterol. Walnuts contain omega-3 fatty acids, which have a cholesterol-lowering effect. Drinking water thins out the blood and reduces the possibility of a blood clot in the heart. When dehydrated, the blood will become thick, making the heart work harder. Drinking adequate water will greatly help the heart in its function. Half your body weight in ounces of water each day will keep the blood flowing properly. So we want our blood to be like tomato juice and not like ketchup. Plants have essential nutrients that promote healing. Hawthorn berries are especially strengthening to the heart and are a known natural remedy to improve heart function. Have some hawthorn berry tea. Health is a great treasure and should be sacredly guarded. Prayer reduces stress and reduces the risk of cardiac arrhythmias and cardiac mortality. The heart patient should become a patient of prayer. Thank you.